So as a medical interpreter, why would you need to know what happens inside a prison? Working as an interpreter, you will find yourself in a variety of situations. Working with a person that has a bump on the head and is just seeing a doctor for a general medical visit, or working with a person that is dangerous and in a mental health facility. You also need to understand that as a prisoner of the California Department of Corrections, if a doctor is unwilling or unable to work inside of prison, they will be seen outside, and these inmates go and see specialists. If there's a community hospital that closes, they will be seen at a Kaiser, at a standard mental health facility. They'll be seen by specialty doctors in small clinics. These people pop up everywhere. Everyone goes to the doctor someday. And as an interpreter, if you think that you're never going to be in this situation and be interpreting for a person that might be dangerous, you're mistaken. And it's better to have all of the facts ahead of time, even though this is prison specific. It's information that you will absolutely use again in your life. So the other places that this information is useful is in mental health facilities. Mental health facilities, patients are stressed, they are unstable, they're not at the highest point in their lives. And that's something that I think interpreters don't realize, is that we don't interpret for people on their best days. If you're at the supermarket and you're shopping, you don't have an interpreter with you. We interpret for people that are in trouble with the law, that are upset and going to medical facilities, and standard medical appointments. A lot of those are very routine. But as interpreters, we're not always seeing people on their best days. The types of appointments that generally occur inside a inside a correctional facility are medical, dental, they do vision testing, audiology. Prisoners get sick 10 times more than regular people. The prison system is very unsanitary, it's very unhealthy. In the last 2 prisons that I toured, that week alone, they had a rash of pink eye, chicken pox, shingles, the common cold, the regular flu, the new California flu that it seems like everyone has. These inmates are seeing the doctors 2 and 3 times a week sometimes. And so the most appropriate interpreter is in fact a medical interpreter to be inside a correctional facility. When inmates are taken outside of facilities, they're taken to see specialists, orthopedic surgeons, things that you would never expect to run into an inmate when you're just going to a community hospital. And a lot of times the interpreters that are working inside correctional facilities, they're busy. And so as an agency, I call interpreters that I know aren't working in the prison systems, that I know aren't busy that day. And so I'll ask a regular medical interpreter to go and work with an inmate that I know is going to be seen off-site. And so without the preparation, I could be sending you into a dangerous situation and you would agree to do it because it's not a prison. So outside of the prison system, the inmates are definitely more aggressive. They are more likely to try and default or to start some sort of a ruckus. There's usually only 2 or 3 security guards in transport with them, and so the inmates do have a higher likelihood of putting you into a dangerous situation. Interpreting inside the correctional facility, there's usually 10 inmates and then 30 or 40 guards all around you. The numbers are a little bit less intimidating actually working inside the facilities.